is, if you lie on your front, you can do a quick examination if you want to. So this would be iliosacral upslip. It's in the notes. There's a leg pull. There's a straddling leg. Can you see that? Yeah. Yeah. So, like some ones that I've shown you extra, so there's no pictures in there. Yeah, you know what I mean? Like the standard lift, other lift, CDs in there. The ribs one is not in there, the picture. Okay, so if you feel the iliac crest, you can do this. So think about landmarks: ischial tuberosity, PSIS, iliac crest. So ischial tuberosity up, PSIS up, iliac crest up, slip. Okay, it could be down slip on the other side, but in reality, down slip corrects itself, whereas an up slip don't. If you go down slip, when you walk it goes up. With an up slip, when you walk it stays up. Yeah? Okay, so if you land on something and your pelvis goes up, you need something to pull it down.
You said that. We're talking,
No, up. Okay. Yeah, so it's all relative.
Like a hip hop.
Yeah, sorry. Yeah, because the QL would be tight on that side. Yeah, because it's pelvis will not go. Yeah, so PSIS is up, ASIS might be up. Yeah, so ASIS up, PSIS up, crest up, ischial tuberosity. If the ASIS is level, it might be an up with a rotation. Okay, so feel the iliac crest, gaze up and right. Keep my thumbs up and right. Okay, so we'll just use a technique to pull that right side down. This one of all the techniques, I've been doing it a while. My patients travel a long way sometimes, even from Ireland, and they go, that leg pull you did at me, it seemed to do the magic. Yeah, that sort of thing. The leg pull corrects the ilium, but also what it also does is, if you've got a facet that's locked on that side because of the closing in, as you pull, it can open the facet. If you've got a disc, I'm not saying it helps a disc, but you might find that because of the pressure change, it might alleviate some of the symptoms. If you've got a rotation, as you pull, it might correct the rotation as well. Yeah? So if you've got pain PSIS inferior, it's because the ilium might be anterior, the long dorsal ligament might be on stretch, so out it hurts. So if you pull in the leg, you can offset the tension on that ligament. So then you've got another effect from the technique. Yeah? It's very good because it's not rotation in the lumbar spine. It's simply a traction pull. Come down the couch and the knees are hanging off. Technique, knees hanging, arms hanging, head to one side. This is the position. Do you know? This is Denise, the cheeky one of the two. Right. Okay, so from this position, leg straight. So when you're affecting the leg for the SIJ, you want to rotate the leg internally. If you have a leg external rotation, it affects the hip joint. If you internally rotate the leg, it affects the sacroiliac joint. It's to do with the iliofemoral ligament locking. So turn the leg in a little bit. Yeah, SI, turn the leg out a little bit, hip joint. So turn the leg in and it's internally rotated. This is your favourite technique, yeah? Okay, so what we're going to do, hand onto the hamstring or hand onto ischium. Yeah, if you want to, because you can stop the left side from moving. Palpate the PSIS. Okay, and you can feel, okay, that PSIS is there. When I'm pulling, I can feel it moving downwards. If you want, I'm not sure if you can feel it yourself there, just there. So the PSIS is moving down. Also, look at what I'm doing. Look at the lumbar spine. As I pull, what am I doing to the right facets?
Open.
Left ones?
Closing.
Closing, yeah? So maybe it might just help the facets as well, depending. Because nothing in tissues. We have this QL, I'm going to change the tone of this right QL. Yeah, because if it's held short like that, by yanking, I'm going to change the tone. Okay, so squeeze the leg. Okay, look at my knees, and look at my ankles, okay? I'm on my tippy toes if you like, so I'm going to squeeze and straighten my legs, yeah? So that's the technique, is a leg pull. I tend to feel the PSIS when I do this. Alright, so remember the chest to draw. You pull the chest to draw to the tension. When you feel the tension, you pull. Yeah? So the chest to draw in, okay, that's mobilizations, yeah? It's only pulling in, pushing out, pulling in, pushing out, pulling in, pushing out. Yeah? The manipulative, pull in, push in, pull out till you feel it. When you feel the lock, pull. Yeah, so from the lock, pull. Okay, so there's no point pulling from the in position. You tension, you lock, you lock, you lock. When you feel happy from there, it's a quick. Okay, I'm going to feel to see if I can move it. Just hold it. Relax, relax, good.
Sometimes there's a big click on that one.
Tick there.
But it didn't. Yeah. Now you're walking on